Hi, I'm Gooby from Gooby and Dooby. So I used to be a neurosurgeon. I went to college at MIT and did 4 years of medical school and 6 years of neurosurgery training, and I was a neurosurgeon for almost 10 years after all of that. So that's 20 years of my life. And I quit. I quit last year.
Hello viewers, in today's video I will discuss why I think doctors are wildly successful at being YouTube content creators. I will tell you the kinds of videos doctors usually upload on YouTube, why these videos are watched by millions of people all over the world, and at the end of this video I will recommend 5 YouTube channels created and managed by doctors. So stay tuned. Broadly speaking, the content created by doctors on YouTube can be categorized under the following 3 headings: tutorials, entertainment videos, and vlogs. Tutorials include videos about how to perform a surgical procedure, how to perform an office-based procedure, how to interpret investigations like CT scan or MRI, how to study for a particular test, especially if it's a difficult test like NEET PG, how to remember a particular topic like say a cycle from biochemistry, how to approach a patient complaining of a certain symptom like dizziness, how to write answers for challenging questions in theory exams, how to even make the transition from a healthcare system in one country to a different healthcare system in a different country. Entertainment videos can be about the various quirky traits associated with specialist doctors from different specialties. It can be about dark humor, and it can also be serious social commentary as seen in the Amazon Prime web series Mumbai Diaries. Vlogs can deal with any topic under the sun, but commonly they talk about the daily life of an MBBS student, the daily life of a postgraduate resident, life after moving from one country to another, and even travel diaries. Now let's talk about why these videos are viewed by millions of people all over the world. Now before I tell you why I think videos made by doctors on YouTube receive millions of views, I must assert with full confidence and a little bit of personal experience that the absence of views on YouTube should never discourage anyone from expressing their views on YouTube. I know about channels on YouTube which have reached cult status because they could provide a funny commentary describing how monkeys can slide down wires. Even serious topics like how to prepare to secure a good rank in difficult exams like NEET PG can and does garner millions of views. Even animation videos made by American doctors describing a middle ear surgical procedure like tympanoplasty can elicit a comment from someone claiming to be from Jharkhand in India, even including a requesting information regarding the cost of the procedure. Remember, this procedure is supposed to be performed in America. What has happened, I believe, is now people have easy access to previously heavily guarded or hard to come across information. This has broken down the inhibition of the viewing masses all over the world, and people are eagerly consuming videos talking about a particular surgery that they had no idea about, or how to ace a particular exam when previously they had no access to toppers. Now let me recommend some of my favorite YouTube channels that are created as well as managed by doctors, starting with Fauquier ENT. Note the spelling. This is an ENT clinic from Virginia in the USA which talks about various surgical procedures as well as other clinical procedures. The second channel which I highly recommend, especially to people interested in ENT, is Learning ENT. This also covers broadly almost every topic in ENT. The third channel cannot be recommended highly enough. This is called Dr. Glaucomflecken, which is perhaps the most entertaining channel on YouTube, period. The fact that it is also made by a doctor, an ophthalmologist who is a board certified ophthalmologist from the United States of America, only adds to the pleasure. It is a funny take on how different specialities interact with each other, what are the different quirky traits of each specialist, like how does a neurologist talk to a cardiologist, how does a cardiologist talk to a nephrologist, etc., etc. It's very entertaining, and most of the videos are in the shorts form. So Dr. Glaucomflecken, highly recommended. The fourth channel that I want to recommend has been dormant for a while, but it is probably the single most important reason why I started making YouTube videos. This channel is called E.n.t OSCOPE, and this is the channel which helped me understand how to prepare for MRCS ENT OSCE. Without the guidance that I received from this particular channel, I would not have had any clue regarding how to prepare for MRCS ENT OSCE. In fact, the person I knew who was preparing for MRCS ENT OSCE thanked me for sharing this information, and both of us were able to prepare in the same way, and we were able to pass MRCS ENT OSCE easily. So if you have any doubts regarding PLAB versus MRCS, or IELTS versus OET, or how to prepare effectively for MRCS Part A, or how to prepare effectively for MRCS ENT OSCE, please check out the videos on E.n.t OSCOPE. Also, you can check out my videos as well. And the final YouTube channel that I want to recommend is one managed and created by a doctor called Juhi Nikudkar, who had secured a rank of All India 7 in NEET PG, and her videos are amazing. They have garnered millions of views, as they should. She has described how she prepared to get such an awesome rank, and she has also made it very lucid for the viewers to understand how they can approach a difficult exam like NEET PG from MBBS days, so that they can also get a good rank. Remember, one of the most important reasons why one does not do well in exams is they are inhibited by their own psychology. Your biggest enemy as well as your biggest ally is your own brain. Your brain, if it keeps telling you you cannot do it, it becomes that much more difficult. So the first thing is believe you can, and then find out how to do so. Thank you for watching this video. Take care, bye bye, and please don't forget to be awesome.